Uh, Good morning. I am John Sampson, President and CEO of the Northeast Indiana Regional Partnership, and we welcome you all for participating in this session, our continuing session on the roadmap to a healthy reopening. Always want to start out by thanking our partners at Parkview Health, Greater Fort Wayne, the staff members of the Northeastern Regional Partnership, and also the Allen County Department of Health. Obviously, this is another one of those examples where if we were not willing to work together, we couldn't pull this off without each other. So really grateful for all the support we've gotten. Special shout out to Dr. Deb McMahon and Mindy Waldron from the Department of Health for the leadership from the very early days of this pandemic. And also noteworthy Heather Shagler at Parkview and the staff members at Greater Fort Wayne Inc. that have done all the necessary work behind the scenes to make this possible. So a great deal of time and effort was put into bringing this together for you today, and hope that you will be fully engaged through the session. This is critical information to getting our region's economy, along with the state of Indiana, our economy up and running again, and on our way to fulfilling our Vision 2030 goals. For housekeeping purposes, a reminder, some of you have been on these sessions before, so these will be familiar to you. Please hold your questions towards the end. We've got some questions we received in advance, which have been already built into the materials. We will again use the Q&A tab, and you'll see that when we get closer to the end of the Q&A session, we'll start taking your questions through that Q&A tab at the bottom of your screen. You will also all be receiving a survey quite promptly following the session for your feedback. And also each participant will receive a copy of the slides and a link to the recording of the event. And a reminder, this is a second session for the education. So if you want any of the fundamentals used in the first session, you can go back and we'll share that link with you later in the session. So first, the next thing I'd like to do is introduce the speakers, and we're starting today with Jolynn Succo, the Chief Innovation Officer with Parkview. Dena Jacquay will join us, the Chief Community and HR Officer. Dr. Mike Nip, the Total Health Chief Medical Officer for Parkview again. And I also want to thank the Allen County Department of Health members. Apparently there'll be a number of helping to field questions today. So with that, I want to turn it over to Jolynn, and let's go.
Thanks, John. Like John said, I'm Jolynn Succo. I'm the Chief Innovation Officer for Parkview Health, and boy, have the last 8 weeks been a time of rapid innovation and creativity. We're sitting here in a large room, all socially distanced, with hand sanitizer. I also am a mom, and so I want to say thank you for all that your schools and school districts have done to get my daughter through the last 3 months of, in her case, 6th grade. And thank you for all that you're doing. So we're here at Parkview, and I want to share a little bit with you at a high level about how we're thinking about getting back to business and kind of the principles that we're thinking about for the next 12 to 18 months. So first, as we think about coronavirus, the virus is here and it's going to be in the community. We know that it's not limited to one place or area, and it's getting much harder to pinpoint where the source of the infection is. So it's part of our everyday. At Parkview, we want to keep the surges of outbreak in our community as low as possible. We have been working very, very hard to implement safe practices that will help our employees, customers, and community, and hope that some of these practices that we've put in place can help you. I'm sitting here today with a wide variety of subject matter experts. You may think of Parkview as where you go to get your health care, but we also have an education department, a simulation lab, a huge grounds crew, 10 cafeterias, certainly, and 10 hospitals. So we have a lot of subject matter expertise that we want to share in gratitude for all that you have done for us. So we're here and we're ready to serve. We are closely monitoring the situation and being very cautious. We've restarted our services very gradually, and we're starting to see folks come back to get much needed care. We're also wanting to share some of our best practices and source best practices from Northeast Indiana and around the world. So we've launched a new service, Parkview Business Connect. And part of that service is a website which is loaded with a lot of great tips and tricks, safe practices for the workplace, for people, resources. We have a hotline that you can call. And we are specifically, over the next month or so, focusing on you. And you'll be receiving a call from us after this to understand exactly what your needs, because we want to provide more elbow-to-elbow support as you work to prepare your schools. Next Wednesday, we'll have a school playbook up for you on the website, which will be full of best practices from CDC, state, local guidelines, and as well as the best from our region. So with that, John, I'm going to turn it back to you to talk a little bit about Governor Holcomb's plan. Oops. One last thing I'll say, here's our Business Connect number. You can feel free to give us a call. We'll get back to you within one business day if you have questions or want to talk to a subject matter expert. Now we'll go back to John.
Thank you, Jolene. Really appreciate what you all are doing. And this Business Connect website and the opportunity to ask questions going forward is really critical. So keep in mind, this is a really important element in terms of the education piece of this. A lot of uncertainty around how to get schools back open again and return to a more normal sense of progress in this area. So today's session is very important. Keep in mind, all of our plans are being done in the context of the governor's Back on Track initiative. While we're all anxious to get back to life as normal and be back in business and back in school and back to living, we're following some guiding principles that have been laid out. And so we've got those highlighted here, 4 guiding principles that we're following as a state. And so it's important that all of our work that we do to get back open to business is cast in the context of these 4 principles. Number 1, the number of hospitalized COVID-19 patients statewide has decreased for the last 14 days. Number 2, that the state retains a surge capacity for critical care beds and ventilators. So we're monitoring that capacity should there be a surge as we reopen the state's economy and also our region. Number 3, the state retains the ability to test all Hoosiers who are COVID-19 symptomatic, as well as any healthcare workers and so forth. We want to make sure that we can keep track. And the last principle then, it would be tracing. Health officials have systems in place to contact all individuals who test positive for COVID-19. So those 4 principles will keep as the overarching themes as we continue to reopen our region's economy and the state overall. You'll also note that today, a special day, we're moving into stage 3 as laid out by the governor's plan for the Back on Track initiative. And so today we're enjoying a little more freedom and life, liberty, and the pursuit of happiness here. So you'll see that restaurants are open at 50% capacity. And I would encourage you to go on the website and look at some of these details. Just Google Back on Track Indiana, and you'll see a number of things that are coming up. We're in this stage through June 13th. So 2 or 3 weeks devoted to stage 3. And if we follow those principles, we should be into stage 4 by June 14th. So with that, we will also just remind you that this is the second in the series of education-related sessions. You can go back onto the website and see the recording from the last session so you can see what was laid out as fundamentals. And with that, I'm going to introduce Dena Jacquay to talk about some of the other principles that we're following for today's session. Dena?
Great. Thank you, John. So I just want to start by echoing Jolene's comments earlier. And as a mom of 3 boys, one in elementary, middle, and high school, I have become acutely aware how much patience and compassion that it takes to be an educator, and have watched the boys walk through just a variety of things that as educators, you've had to rewrite the script on and completely change the way that you're delivering education. And so as a parent on the other side of that, thank you for doing that so quickly and being able to communicate with just masses of parents and lots of challenges that I know that you've dealt with just as we have here in healthcare. So I want to start by talking a little bit about the workplace and the people side, and then we're going to get to Dr. Nip and talking about some very specific industry things. But first and foremost, as you're thinking about, what the next several months look like, and as we get to the fall, identifying a workplace coordinator is going to be really important. And you know that your parents are all receiving lots of information from a variety of sources, both local and regional and national, but you also know that there's social media out there. And so how you can control the message of what they're hearing is really important. And so many of you have already done this. You've got great ways that you're communicating out to your parents, and some are doing videos and virtual calls and Zoom calls. And so I think that those are going to be great things to continue on into the future. But having someone within your school system that is that central point of contact and who can keep up on all of the ever-changing guidance from CDC or anything that is happening regionally or locally is really important. Flexibility. I mean, we all have known that flexibility right now is what we've done for the last 3 months. Things we never thought we'd be doing, we're doing now. But there are also some great things that we're taking away for what will become part of our best practices in the future. So while we're going through it and while we're flying a plane and fixing it at the same time, it's good that you step back and think about what are you going to continue on that parents have enjoyed, students have enjoyed, things that help you communicate with everyone within the school system. As you look at the preparedness plan, a few other points that I think we've learned and lessons that we've learned along the way here at Parkview, this phased return. So as you think about who comes back to work and when, it's going to be important to maybe not bring everyone back all at the same time, particularly over the summer months, and what does that look like? And then as we head into the fall, for Parkview, for instance, we have about 4,500 of our coworkers out of the 13,000 that are working from home right now. We're not going to bring everyone back all at the same time. As a matter of fact, we're going to bring 20% at a time, but do it over a period of 8 to 12 months. So we want to be able to keep everyone safe and the environment safe. And to do that, we're not going to be able to do that all at once. So think about who really does need to come back and when, and being able to be accommodating, because we also know that everyone's schedules have changed, certainly, and their needs have changed. And now that we're past, most school systems have let out for the summer. What does that look like for summer school for some? And what does that look like for who you need to be on your campuses during that period of time? Communication. It's common sense, I know, but over the last several months, communication is what has kept everyone informed and all the key constituents that you have. And so think about how you want to be able to continue to communicate over the summer, and obviously as we get into the fall with your parents, with the students, keeping up some of those same regular practices that you've been doing now through the digital learning. When you're also looking at restarting, and obviously as we head into the fall for school, consider you're vulnerable. You may have some teachers that are vulnerable and won't be able to necessarily come back into a classroom. Or what could you be having them do? Or even some of your administrative support won't be able to come back. Or you might have to have them doing something a little bit differently so they're not susceptible based on underlying health conditions that they have. And you may have students that are vulnerable. So having policies and practices in place ahead of time so you're not reacting to those things later is going to be important to show parents that you're being proactive. Another thing that I feel like is certainly common sense, but we've learned a great deal from, is simply asking people. Asking your team, what do they need? What they needed 2 months ago is different than what they need today. So that voice of your coworker, the voice of your team members is so important throughout this, and it changes. I think that's another lesson, is what we ask them 2 months ago here and what was needed is not the same. So we have to kind of evolve to what support we're able to provide our team members. The same thing with your parents and families. Parents and families want to know how you're going to keep their children safe, and how you're going to keep their children safe through its extracurricular or through their school and education. And if they're all together in a classroom, what does that look like? So those questions are already, of course, starting, but will continue as we get through the summer and closer to the time that school starts. So asking families and asking the team members that you have along the way are important. And then finally, one thing that we would also recommend that you have is a plan in place for what happens when a student has been ill and they're coming back to school, or what happens when they have an ill family member and they've been at home and now they're coming back into the classroom. What does that process look like? Same thing with your team members if you have a team member who's sick. And so as Jolynn mentioned earlier, when we provide this playbook and we provide that at the elbow support, we want to be able to help you create what those practices are, so that we want to have everyone across Northeast Indiana be consistent in how we're approaching this, so that doesn't matter what school system we're talking about, we're all doing it the same way. And so parents can feel as though we've coordinated very well to create that safety net within Northeast Indiana and how we're best taking care of our children and our families and certainly our coworkers. So I'm going to turn it over to Dr. Nip, who's going to provide some K-12 industry specifics. He's our medical director for Parkview Total Health. Thank you.
Thanks, Dena. Hi, everybody. Dr. Mike Nip here. So I'm an occupational medicine physician, but I'm also the son of 2 educators. So I realized that education, even when there's not a pandemic going on, is a tough gig. I'm also blessed to be the dad of 3 great kids. So the bottom line is thank you for what you do. And we're trying to reach out and help you do it during this time. So a couple specific things regarding K-12. First slide here, this is from CDC. So the lifeguard, so to speak, has said everyone can get back in the pool in phases, but should you go back in and swim? So what this is, and you can land on that site, it's also available at our site, is a checklist to see, are you ready? See where you are. Are you just starting along the way or about ready to open? The thing that's going to be a factor for all of you is waiting on the governor's guidance coming out here in a couple of months to say what are the must-dos and the should-dos. Again, to reiterate what Dena was talking about, getting a point person at the workplace to coordinate all the different processes and procedures to implement Q&A and change as needed. So July 4th is when a lot of this guidance is going to come out, but it's at least a mile marker, but it's not the finish line because schools and other businesses are going to have to create sustainable practices for the foreseeable future, at least back to the 12 to 18 month timeline. But the medicine is changing and everything else will have to adapt as well. Next couple slides here. The CDC did a data dump a couple days ago regarding guidance and steps to take. This is available at our site, and again, will be incorporated in with the playbook to help you make specific decisions, kind of the nuts and bolts, as it were, regarding the different areas, because schools are not just classrooms, they're cafeterias, labs, gyms, outdoor spaces, office spaces. So there's a lot of specific guidance for different industries that has to come together for schools, and this puts it into a format where you can identify where you are and what you need to do. So I want to talk briefly here with this slide, hierarchy control. So this is a core approach and principle from the industrial hygiene world that I am very familiar with. It's an approach to any exposure or hazard, and how does a workplace approach that to minimize or mitigate what they're able to do to optimize an environment. So there are different levels there. You can see from the top going down from the most effective to the less effective. I want to highlight the more than a mask phrase that's there. That's what we've been saying at Parkview, to say we, yes, might be using masking to help protect our patients and coworkers, but we don't start and stop there. We look higher up on the hierarchy there for solutions that may be more widespread and implementable that can happen first. So here's an additional slide with just a couple things to call out. So just for example, elimination, if you had to pin me down, what's the thing, if we can do one thing, Dr. Nip, what should we do? Well, it's to have ill staff and students not come into work. If they're not there, I don't know how they would be able, there's no exposure or way to spread. Easier said than done, of course. Engineering controls, this is where you are changing or physically affecting the environment to adjust to mitigating an exposure. Administrative controls are focused on changing the way people behave or work or learn in that space. And then down there at the bottom, PPE, which we're all familiar with now, personal protective equipment. This is where things like gloves and masks and things like that come in. So a few couple things here, just to summarize, the CDC to prevent or lessen the spread, these have always been good ideas. They're good ideas now, they'll be good ideas moving forward. If you're sick, don't come to school. And I wanted to highlight too that when you are implementing these procedures and processes, we want to make the optimal healthy choice as automatic and easy as we can. So that might be a flexible sick policy for kids, to flex to the teachers regarding homework. Same thing for your employees, to be flexible, because you don't want as we don't want an athlete to play injured, we don't want a student to come work sick, or a teacher or staff member as well. Covering coughs and sneezes, having things available to help with that, tissues and whatnot. Cleaning and disinfecting, we'll get on this a little bit later, but a high-touch surface is probably a phrase you've been hearing. These are your doorknobs, your handles, your staplers, those sorts of things. And then washing hands, I learned it in kindergarten, have gotten even more vigilant about that. Soap and water, preferable, but also making that hand sanitizer available so that healthy choice can be easier for a student and staff member to make. Having said that, I am going to turn it back over to John for some Q&A. John?
Thank you, Dr. Nip. Really appreciate that. And just a reminder to everyone that we've got all the professional staff at Parkview standing by to answer questions today, and also those from the Allen County Health Department. And if we can't get to a question today, we will certainly, we encourage you to go to the Parkview Connect website and post that question, and they promise to get back within 24 hours. And also, please, you can start now feeding any questions that you might come to mind in the Q&A tab at the bottom of your page. So let's go to the first question, and thanks to everybody who submitted some questions in advance, allows the Parkview team to prepare. So let's kick it off with this one about social distancing, and some of the other measures don't always seem realistic for schools. Should we just focus on making remote learning the best it can be and only offer that?
So John, this is Dena. I'll start this question. I think that, and it's hard for me not to put my parent hat on right now too, right? So remote learning really is not the first choice that we want to go to for schools, for families. I mean, children returning to schools for education, social development needs, things that, you know, when we think about what individuals are going to be like as they're going through this, if they don't have that social development, what does that mean longer term? We had the K through 5 kind of pre-K earlier, and thinking you can't prevent children from touching each other, and they're learning and they're so young, we can't prevent that interaction. And so there are safety measures, and we're going to talk about a lot of those today, and Dr. Nip has mentioned several, you can put into place to minimize the spread while still being able to do in-person, hands-on, but it doesn't mean we're going to have to change the way that the schools are configured and how they look, and I know that's what we're going to cover a lot in some of the Q&A today as well. I think it's important to remember that there are things that run deeper than this moment in time. And it's going to be about how we can best provide education to our youth.
It's Dr. Nip. I agree completely, Dena. I just want to add a couple things that I don't know if it's on our slide, but a phrase we've been tossing around here is not missing the good for the perfect. I think many days coming home, I need the hug for my kids as much as the kids need it from me. So one of my other hats is a lifestyle medicine boarded physician. What we're trying to help people do is keep their immune system as healthy as possible right now. And one of those core principles from our college is the connectedness. Of course, we can Zoom and FaceTime, but it's just not the same as being there in person with folks. So we want to do what we can, knowing the only way to not have any possibility of transmission is no one comes into school. That's a non-negotiable. For the things Dena mentioned, we have to have development on the whole person. And so I think we try to do the best we can. And I will say remote learning could also be used as a strategy for when that child is sick, but as a widespread first choice, it may be as farther down on the hierarchy.
Very good. So along those same lines, with the understanding that schools have limited financial resources, which measures would provide the biggest return for the investment of those schools?
Dr. Nip again. So I think I mentioned before that, so an elimination strategy, having, again, if we had the one bang for the buck, it's ill folks don't come into the building. I get it that every school is going to have different resources to implement. But again, how much does it cost to put plexiglass barriers up versus supporting a policy where it makes it feasible for ill folks to stay home so they're not worried about PTO or missing classwork and those sorts of things. I think the more than a mask planning is very appropriate. This is also a slide we can make available where it's a worksheet, as it were, and I think you may need to print out as many copies as you can get because, again, like we said, a school's not just a classroom. You're going to need to probably think of different strategies for each area, and even the spaces that get people to spaces, the hallways, the entrance and exits, all of these may need, I think we've been calling, fresh eyes and looking ahead to how to redesign things that'll be sustainable and will be good ideas.
Thank you, Dr. Nip. On to the next prepared question. We are limited to the buildings and spaces that we have. How can we be creative to offer education in those spaces safely?
Good morning. This is Matt Holycross. I am one of the education and training managers here at Parkview Health. So we do a lot of classroom training. Just like you, we've had to come up with alternative ways to train, looking at virtual classrooms. But there are still classes that have to take place in person, especially any of those hands-on type labs or classes. So we've looked at all kinds of different, obviously following the hierarchy of controls, which Dr. Nip has talked about previously, staggering start and stop times. So whether it is bringing different classes in at different times, or when you get to the end of the day and the dismissal, you may look at the students that are riding the bus, they get dismissed by classroom, and then those are being picked up, and then walkers and so forth. So just any way that you can minimize the foot traffic. And then from the classroom perspective, it's really anything that you can visually do, blue tape, anything that's just a good reminder for students and staff to be able to socially distance, but still maintain the feel of a common classroom.
Great, this is Dena. I'll just add, Matt did a great job of outlining some of the things that we've done, and another idea that had popped up was around changing classrooms, but having the educators change as opposed to the students. So we all know what that's like in middle or high school where the bell rings and you've got swarms of kids everywhere. And so instead of just kind of preventing a lot of that interaction, being able to move educators around and keeping the students socially distanced within the classroom would be yet another way to minimize any risk.
There's some great insights there. This question comes up in all different sectors. So now we're going to apply it to the education world. How should we be screening staff and students coming into the building?
It's Dr. Neb. I'm going to have Mindy chime in here in a second to add. So this is definitely a challenging topic. I don't know. I don't think we know what's going to come down from the state in a couple months to say what has to happen. And a very good point on a previous webinar this morning, Mindy mentioned that the guidelines are a little bit behind the science sometimes. Having said that, if no pun intended, hot topic temperature screening from the literature, it does not work. We don't have a temp screening policy here at Parkview. Literature I have found looked at previous pandemics, millions of travelers screened, there's not even on the blip of the return on investment. So that again puts it up against to say, trying to manage that, that's a PPE use, that's exposing screeners to how many dozens of people a day. What do you do with the temperature reading? If it's going to be used to make a decision that is protected health information, has to be protected. It has to be applied in a non-discriminatory way to the principal down to the kindergartner. Self-screening is a much simpler way. Again, having a kindergartner self-screen versus a senior in high school, those are different zip codes. But the availability of self-screening is very good. Parkview has a symptom checker, CDC does. And again, it's just the second point, ill folks don't come into work, and you make it that it's not going to be punitive if they don't. So it's being flexible, accommodating, things like that. And I will start with this, and I'm going to let Mindy chime in. If there is a case of COVID, mission critical, the local health department is going to walk step in step with you, as they expertly have done for umpteen years in the community. Mindy, additional thoughts?
I agree with Dr. Nip and what he said about the effectiveness of checking temperatures and those types of things. The symptom screening and some of the other options are definitely better. And the good news is, in some of the guidance that came out just yesterday for the K through 12, I am not seeing a lot about temperature screening. So that's good. I am hoping that has caught up for the older groups, because I agree with Dr. Nip. And then I believe we have some slides to talk about when we have potential cases, how we deal with that. But you're exactly right. We would walk through every situation and make a situational decision what's best for the facility and the people involved.
Thank you both. The next question relates to just the simple behaviors of children. And I will mention there's one, just to remind everybody, we will email a link and a copy of the slides immediately following. So if you want to make sure you capture this information, it'll be coming to you shortly. But in this case, children of all ages want to be close to and interact with one another. Do we really need to keep them from interacting or touching one another?
So it's Dr. Nip. I'll start. I'll open it to the experts in the room as well. And I just don't think it's, education is not just the 3 R's, it's social and emotional development. And so we don't want to get in the way of that. There's the phrase at the bottom, we don't want to hit the perfect and miss the good there. We do the best we can in that way, but we also, the second point is to encourage, model good hand hygiene, other things like that, to be very visible about it, buy-in from the top down. The principal or something else says this is just a new way of doing it, it's a new habit. The school nurse is key to being able to help classroom to classroom put up signage. And also, again, you're just with the hand sanitizing stations, it's a lot easier. They will never be able to hand sanitize if there's not one there. But something we've even chatted about is clean hands come in and leave a room. Making it very easy in the lunchroom, perhaps, again, with what was mentioned by Matthew about the taping on the way to the lunchroom. Are there hand sanitizing stations along the way? So you're engineering in here's how you can control or help control or guarantee cleaner hands going into a lunchroom. And I'll open it up to our, I think we have a couple nurse partners here as well, or anybody else who would like to add.
This is Carmen Moore, and I'm with Parkview Community Nursing, and our nurses work really close with the school nurses, and the school nurses can definitely help facilitate education in the schools with the teachers as well as the students. They can go into those classrooms and help with some of those educational pieces, teaching students how to wash their hands, good hand etiquette, good respiratory etiquette, teaching them how to cough into their sleeve, cough into their elbow instead of coughing into their hands or sneezing into their hands. So the school nurses could reinforce that at the beginning of the school year, as well as ongoing throughout the school year, just to sort of continue to remind them of good hand washing and good cough and respiratory etiquette as well. So use your school nurses for those educational pieces. There's some wonderful posters and signage already out there on the CDC website. So print off some of those in your schools and make sure those are posted in the restrooms and throughout the classrooms, just to remind those students of that as well. And even in the lunchroom, if they do end up going into the lunchroom to gather food, making sure posters are there for those students to know how to use good hand washing at those hand washing and those hand sanitation stations. That's really good for them. So use your school nurse to help with those educational pieces for sure.
Thank you. So we're going to dig in a little bit deeper here with some other activities that go on in school routinely. How do we safely deliver lunch, recess, and other large group activities in the school settings?
Thanks, John. This is Wes Oburn, Corporate Director for Food and Nutrition at Parkview. I've been looking forward to this one because I feel like most food service operations, K-12 is most similar to what we do in healthcare as well. We have large groups of people that it's non-negotiable for us to feed or not to feed. So multitude of considerations, knowing that the state will probably come out with some very specific criteria for school systems. I would stress making a plan and making a plan early and be more aggressive than you think you might need to be now. Because as best practices come out for the schools, knowing that there will be probably supply chain issues on specific things that you might need, disinfectants, materials, disposable wares, all things that I have fought through for the past 8 weeks. But for lunch services specifically, considered in classroom meals, consider spreading out lunchrooms into potential gymnasiums. Are there green spaces that might be available as well for dining when it's nice out? No self-serve is strongly recommended against. That's not allowed right now, actually, outside of gas station type facilities. No shared utensils. Really walk in your facilities, knowing that, like myself, we've taken very broad standards that have been issued from the state and had to apply them to nearly 20 different facilities because they're all shaped and they all look much differently. Really walking and making sure that traffic flow is adequate. You know, I think like a lunchroom in a school system is like halftime at the Colts game, right? So you are really, really getting a lot of people through at the same time. If you are looking at feeding in classrooms, there's a lot of logistics and timing that goes through that, as well as quality for the nutrition for kids. So happy to collaborate, and hopefully a lot of collaboration comes out between the two groups post this.
And Dr. Nib, I'll take what many years was my favorite class at school, recess, for a second. So yes, recess needs to happen. Burn off energy, social emotional development. I don't think there is any way to keep up with a cleaning schedule with large equipment. It's out in the elements anyway. Focus on what you can, high touch equipment. This could even be swing seats and the chains on there, because that's where hands are gonna go. If possible, we've been tossing around, sorry, no pun intended, regarding balls and other footballs, basketballs, soccer balls. Is there a bag of Monday soccer balls, a Tuesday, a Wednesday, that sort of thing? Obviously that costs money. This physician would support a statement for why schools should get extra money for playground equipment so they can implement that cleaning protocol to reduce exposure. So I do think there are new ways to do things. But there still needs to be tag and hopscotch. Gosh, I'm dating myself here, but whatever kids are doing these days, I think there's ways to bang for the buck, but each playground is going to be a little bit different. But those are some general principles I'd offer.
Okay, so we keep continue to apply this principle about thinking ahead and planning and engineering our spaces to accomplish these basic objectives. The next question is, what should we be asking our students to do in regards to mask wearing during lunch, choir, band, gym, and so forth?
Okay, I'll start again. It's going to be really tough to wear and eat with a mask on. I think as well, do sports. You know, I think we try to hit the good and not miss it for the perfect. Stay home, cover, cough, sneeze, clean and disinfect, good hand hygiene. So if there is going to be encouraged mask use, again, empower the students and staff to know how to use it correctly, store and wash it. If there is for employees, teachers, if it becomes a requirement, a masking policy, how does that look uniform for every teacher? And also for student, what's allowed, what shouldn't be on a mask, that sort of thing. The bottom point there, choir and band is gonna be tough. My kids are in show choir and band. I will highlight a study real quick that there's been some unfortunate clusters in choirs where in just singing, it produces aerosols and the particles come out. They even narrowed it down to the TH sound. But it may be something we have to get used to, a face shield over a singing choir member, and I'm not trying to single out flute players, my daughter is one, but flute players are going to be blowing across the instrument, producing that sort of aerosol as well. So I still think choir and band can occur. If face shields are going to make show choir tough, you know, let's make sure ill kiddos are not going to be participating in those. Let's space out as we can with the room we have. It may mean the new routine is kids help move the chairs around so we have a same space, larger usage area. It's just going to be specific solutions for each school, each area are going to come to the fore. And to echo Jolynn, now's the time to innovate.
Thank you. What are the recommendations for students per square feet or population density, in essence, in classrooms and other shared spaces?
This is Matt Holy Cross again. We just like here at Parkview, we're still following the 6 feet of social distancing as a standard. Obviously, as the governor increases the guidelines as far as amount of individuals in a room or a shared space, we'll still have to follow those. Depending on the room and depending on how that room was set up previously, we do have challenges even here based on hardware, desks, and so forth. Just looking at anything that you can do to creatively maximize the space as much as possible, such as having all desk space in the same direction, or even you just in a larger room, maybe kind of fanning it out a little bit if that's possible. Again, having the students sit as distant as possible. And then just like we've talked about before, the traffic patterns in and out of classrooms or in and out of rows, making sure that there's plenty of room, especially as your teachers may need to come and assist a student. They want to still be able to do that and have that extra sense of comfort going up to another individual's desk. And the last thing that I would share too, just some common sense practices. If there are chairs, desks, anything, if it's a computer lab, if there's computers that you can take out of the room just to open it up more, anything that can be moved out of the room to help accommodate the space works really well.
Good, thank you. We've heard a lot about using redesigned traffic flow patterns to help with social distancing and crowd control. Do our building entrances and exits need to change?
Hi, this is Tom Rhodes, Parkview Public Safety. Also have the unique opportunity of serving on one of our local school boards. So we have had a lot of discussions around this. Obviously, with school security being a major issue, many districts have restricted the number of entrances that students have access to, certainly during the school day, but also at the beginning and the end of the school day. Bus traffic is obviously limited due to the necessary space required for buses to get in and out of the school district, but I think it will be important to open up other entrances and maybe even look at doing entrances by alphabet. If your last name is in A through F, your parents drop you off at a certain location. So I think it is good to distribute the traffic flow as much as possible. But I will certainly tell you these are all serious issues that are tough to get grips with when it comes to the education next year and how it looks.
Thank you. The next one, going into the physical design of our facilities, what are the HVAC recommendations for schools?
Hi, this is Anna Belote, Director of Safety for Parkview. Had quite a few questions regarding HVAC concerns, and right now the American Society of Heating, Refrigeration, and Air Conditioning Engineers, a mouthful, ASHRAE, in concordance with the CDC, has some very good information out there, not just for schools, but for all entities on how to manage your heating, ventilation, and air conditioning at your location. So I would highly recommend, I believe we'll have some resources on our site. I would highly recommend that we tap into those resources. It's very intuitive, very easy to follow, and really just want to take that at your location as needed, because everything's going to be a little bit different depending on what business you have.
Great. Thank you very much for that. Certainly another dimension of our educational process is field trips. Can we continue to offer field trips?
Hi, Dr. Nipp here. So I think the answer is going to be a qualified yes. We need to know what the state has to say. CDC has guidance here that we can see is, step one is pretty bleak and doesn't complete the educational spectrum that our kids need and our schools want to offer. Hopefully we can go to step two based on where things are and just do old things a new way. Smaller groups, for example, anything that can maintain social distancing, hand hygiene. Again, I'm already seeing here, if we, instead of the whole third grade goes to the museum, is it every day that week? Again, that means more buses. It means more financial resources. But again, this is the process of the ask from schools. Here's the medical support for why this should happen and why it reduces exposure. And that can be a continued process, I think. So other things that are innovative, a virtual tour possibly, or bringing the experience to the schools, another option you could consider. If it's an art thing, bring the artists in or bring samples of the art or something like that.
Thank you. Good idea on that virtual tour. That may be necessary in the near term. Just a reminder, the Q&A tab is at the bottom. If we've got one open question right now, but I encourage others to register those as we approach the end of the hour here. Our next pre-positioned question: what can we do to encourage students to make the right choice? What can we do if they don't follow our guidelines?
So this is Dena, Jacquay. I think it's really important, and this goes back to some of my earlier comments around communication and how important that communication with students and families are, and throughout, not just a week before school saying, here's what we're going to do. It needs to be over the summer. It needs to be constantly what is happening and what you're thinking. Engaging them for feedback is really important along the way, whether it's students or parents. We also know that teachers, while they have a very tough job, educating students. We also know that's going to look a little different come the fall, and they're going to have different challenges when it does come to students interacting. And so make sure we're equipping the teachers with all the right tools so that as a school system, we're wrapping our arms around those that are going to be coming onto the front lines with students and having those interactions on a regular basis. If we don't equip them, then we're not going to be able to do the job we need to. Posting signs, I think, as Carmen mentioned earlier, just simply proper hand hygiene, having those stations set up, being able to increase the access to some of these supplies so that people are thinking about washing their hands on a more regular basis. But we also know that each of you have policies in place now for school systems that already address when things go not the way that the guidelines state. And so we would encourage you to don't create something new, use what your current guidelines are that help you. Whatever those rules, those new rules end up being, we can use those same practices to guide through this new time.
Very good, thank you. Certainly we have a very diverse population representing these schools. So in this case, several of our teachers are over 55 years of age. How do they work one-on-one with children safely? Should teachers and kids be socially distant?
This is Dena again. I think it would be really hard pressed to say that we need to separate teachers and students. I mean, in particular, we've watched how this has played out over the last few months. And that disconnect between students and, yes, you were able to see them virtually, but that connection that you have between the student and between their teachers certainly was missed. And so because we can't social distance, we're going to have to work through what are ways, and in particular with this question over someone who's 55, Governor Holcomb had mandated to accommodate teachers who are at high risk. And so those may be those over 60 and those maybe that have other high risk factors. There's a lot of perhaps accommodations we need to think about, and it might look different per person. It might be you have underlying health conditions that restrict you from having access to these situations. And so we have to work through what those accommodations are. It may mean that you're going to have some do remote work. It may mean that the job function is going to change a little bit in terms of what they're doing. And so it's important to just step back and look at what each individual is needing. And you're going to have the same thing with students. Frankly, I know this question wasn't around students in particular, but you're going to have students who need accommodations as well. One of the questions that's just live coming in that I feel like is good to address. So is the employee's responsibility to tell the corporation they have medical issues that make them high risk? And as a individual working in an organization, yes, you need to be able to come forward and share that you have an accommodation and what that accommodation, and that's that whole interactive process between a business and that particular coworker working through what does that accommodation look like, and working through there may be accommodations that the organization can't make, but we can make other ones that help address the situation. So again, that interactive process that should be happening now through any of the situations where you have someone who needs an accommodation, you're going to do the same thing.
Dr. Knipp, I just wanted to, well said, Dena, I wanted to piggyback on that just a little bit. Process-wise, often the employee will say, I need an accommodation. The treating provider or providers for that person should delineate, not necessarily, it's not disclosing the diagnosis, but what accommodation needs to be made. You know, on other things, they can only lift this or should not do X, Y, Z. And a time limitation for that, is it from now on? Is it for 2 months? A helpful link for that advocates for everyone involved is your occupational health practice, because they can take the medical condition with the treating provider's expert advice, because they manage that for the patient, and match it to the job and help translate a workable accommodation for that employer to find a path that keeps that person at work, possibly, like Dena said, doing something a little bit different. But again, so it's not either, so you're not getting employees afraid to come forth and say, I have a health concern, and just think well, I just don't have a job, I'll just not work anymore, or it's a not an all or nothing. There is a wide middle that everyone can find and walk together through.
Really good counsel. Before we go to our next pre-planned question, I want to grab one of the questions in the queue here from Sarah Miller. She asks, what should be considered for water fountain use? Do we need to keep it at students using their own water bottles?
This is Anna again, and I would recommend moving to water bottles. It's going to be very difficult when you have the public water coolers or drinking fountains to keep those sanitized. So my recommendation would be to definitely move to the water bottles for the children, but make sure that there's a process in place as well for them to take those home and wash them routinely.
Very good. And thank you for that question, Sarah. The next question that we have it pre-planned for, next slide, there we go. What steps are taken if a staff member, student, or a family member tests positive? Very important question. It's a likely event to happen across our region at some point. So what do we do?
It is. It's a real good question. And this is Mindy Waldron. I'm the administrator of the Allen County Health Department. And every situation is a little bit different, but when it comes to isolation and quarantine, it's fairly easy to work through the algorithm. And just reminding folks that the difference between quarantine and isolation, because I'll say those and we hear those a lot, and isolation is where we separate the sick folks or the ones that may have COVID from those who don't. So even in their home, which is most likely the time or the place that is done, they stay away from the rest of their household family members as they can. So again, it's separating the one that has it from those who don't. And then quarantine is what we do with someone who may have been exposed to that positive case, where they then will be separated, their movement will be restricted, so we can see if they do develop symptoms of the disease, or if they are tested, if they do indeed pick it up. So they're slightly different, but anyone who does test positive is placed in isolation by us, and like I said, at their home. And if they were asymptomatic, or I'm sorry, if they were symptomatic at that time, to be released from isolation, they would need to be at a place where it's 10 days has passed since the symptoms started, and the person has been fever-free for 72 hours without the use of something like Tylenol to bring that down, and the person shows overall improvement in the symptoms. Those are the generalities of what the rules require of what we will discuss with people before we release them from true isolation. If they were asymptomatic at the time, we can't really base it on symptoms as far as time frame. So that has to be done until 10 days have passed since the test itself was collected. So then we look at contacts, those that were around them who were high risk, and again, they're in quarantine and we're watching them. But what happens with them is those folks must stay home and complete a 14-day quarantine. And that starts, the time frame for that starts on the last day of the exposure to that case. And they also need to remain separated from that case. And we realize that, say, a mom and a child, that's hard to do. So if you can't be isolated from the case while you're in quarantine, it kind of extends the amount of time you would need to be in quarantine until we have the person that was ill has resolved. And then your quarantine or the child's quarantine period would start then. So it can be sometimes up to 3 weeks. It's very situational, and we help folks along in every single case.
Thank you, Mindy. Very important series of steps there to follow, and some related questions here that we need to dig into before we close the session today. If a child's family member tests positive or is under quarantine for possible exposure, should the child be allowed should the child be allowed into the center?
The school, probably, they mean.
The school center, right, the school center, sure.
Sure. Again, a very good question. And the answer is no. That child would be in quarantine because they would have been a close household contact. And again, we want to be monitoring them and not having them in a situation where they could potentially spread it if they had picked it up. So they would be in quarantine at home, and they would need to stay there and watch themselves, or the parent would watch them for symptoms throughout the isolation period of that family member. And then the quarantine and the self-monitoring period, again, is generally a 2-week period. But again, that's sort of based on the situation as to when they were last exposed to that sick family member. And schools will want to consider how they can either do distance learning at that time or sending things home that will be opportunities for continued learning while those folks are in quarantine or those kids are in quarantine.
Thank you. The last prepared question, I believe, in the queue here, we have no open questions right now in the Q&A tab. If a staff member or student tests positive, do we need to close that classroom, the entire school, and if so, for how long?
Sometimes yes and sometimes no, but most often this decision is made in collaboration with the school and those that are involved. If you have something that's very isolated, there are opportunities where we can employ measures to keep things open if indeed you're wanting to do that. Oftentimes with schools, they'll decide on their own that it seems better for them to close, or there's too many that have been exposed and they really can't figure out how to keep the full facility open or a certain sport or however it happened. So no matter what, though, we will always explain the situation and work through it. But anyone that was exposed, whether short term or anybody that was in the facility or the school, they'll still want to self-monitor because they could have had exposure. They could have touched something or they could have been walking by them in the hall. So they're still going to want to self-monitor, and that's on their own for a period of those 14 days for symptoms. And we can, as it says there, contact us because we get these calls all day, every day, and can help walk through the scenario of your school. Now, the high-risk contacts that we talked about before, and they've changed this a bit as of recently, that we more or less look for those that were within 6 feet of folks for more than 10 minutes. You'll know that it used to say 5 minutes, so now it says 10 minutes. And if they were not wearing PPE, meaning masks, appropriate masks, they would be considered high risk. And what they must do is begin that 14-day quarantine period, whether those are other teachers that were in the teacher lounge with them, or they go to lunch, or their friends outside of the school, or if it's kids and they were in a group activity and close, as we've defined here. Those are the things we'd look at first to make determinations. If it ends up being, well, gosh, this person or these people were everywhere, or they do this and that because they're this type of teacher and they come in close contact, then sometimes it is better to interrupt the spread. And from a safety and PR perspective, sometimes schools will close or short areas of it will. If there is an entire area, classroom, big group, they all have to be notified so they know the risk, and it might be potentially possible that those would have to be precluded for that next 14-day period to watch people for symptoms in a contained environment. So again, there are once in a while times when we can leave the other parts of the facility open. It's a decision made at the time and depending on size and interactions.
Great response, Mindy. And now that you're warmed up, we've got one more question for you. So don't get relaxed yet. One question in the queue, a really important question. How do we communicate to parents to inform us if someone tests positive?
Can you say that again?
Sure. This one is from Paula Thompson, and she asks, how do we communicate to parents to inform us if someone is positive? One of the students.
Okay, I take this, I was confused by the question. So if this is coming from a teacher or someone at a school, I assume is what they mean?
Sounds like from an administration standpoint or from the teacher standpoint, how do we get parents to be closely monitoring and communicating with the school if someone should test positive?
Okay, I understand. I'm sorry I was lagging there. Good question. And sometimes that might come from us. So when we are doing a case investigation, which has now been shifted a little bit to the state level, but we hope to somehow remain in that loop and context. So if someone does test positive, and let's say we're looking at their age and they're a 16-year-old, we're going to assume they're in some sort of school and perhaps other activities. So when those questions come about, we'll find those things out. It's a 13-page case investigation. When they say I attend X school, that's a big red flag for us, daycare, schools, large employers. So we will generally proactively reach out And we will inform the school that they've had a case, and we do need to obtain additional information. So many times we will be the ones that tell you. Now, sometimes that won't be. And the person that may speak with the folks that have become positive will indicate you will need to notify X, Y, and Z. So they will promote it to say you'll need to contact your school or your employer. So there's no perfectness to it unless it's done by us, because we do want to be proactive. But we have been telling schools and other employers, encourage your staff not to associate a stigma with this. This is about protecting the entire public. So being okay with sharing that information with them so that the information can get out to protect others. So you can only do your best to encourage them in your preschool year communications, newsletters, making it okay. Not making it that they've done anything wrong, that they've contracted it, that kind of thing, making it comfortable. And then you can always, if the school gets wind of, which is typically what we hear, is the employer heard that so-and-so might be positive, we can help with that and either squash rumors and that kind of thing, or we can corroborate certain things where we feel if the greater good is that we communicate certain things to you to get you on the right road for decision making, we can do that. So we do encourage just communication with us if you feel we need to help, but getting parents to report those types of things, making them comfortable, is likely the best way.
Thank you, Mindy. Great response. With that, we're very close to being the end of the session. There is one question in the queue about bus and seating, which we can answer directly, and but we're over time right now, and I want to make sure we respect people's lunch opportunity here. So what I want to do here is remind everybody of the Parkview Business Connect question website. We are so blessed to have incredible partners to help us walk through this process. You know, we've talked about the principles over and over again, but we're now applying those principles to new locations, new practices, new behaviors for students and teachers and schools. And just don't go through this alone. Reach out and get help from the Allen County Department of Health, from Parkview, from anyone else. We're all sharing experiences and learning from one another. So please don't go through this alone. And again, thank you all for attending today. Thank you for our incredible partners at Parkview and Greater Fort Wayne, Inc., and the Allen County Department of Health and all the partnership team members that help pull these things together. We're grateful for you all, and we certainly want to see school opening under difficult conditions, but to get the full breadth of being with teachers and students together and learning in the future. So thank you for attending today. And we will get a survey out to you and slides shortly. Thank you and take care.